Hello, my name is Jess Berg, and I am an occupational therapy student completing my doctoral capstone at the American Stroke Foundation. Today, in this presentation, I will be talking about ways to recognize and prevent caregiver burnout. What is caregiver burnout? Caregiver burnout is a state of physical, emotional, and mental exhaustion as a result of caregiving tasks and demands. There are various causes of caregiver burnout that can be found in the literature. First, role confusion, which presents when individuals are thrust into the role of caregiving and have a difficulty separating the role of caregiving from being a spouse, child, or friend. Role confusion can also arise when authority shifts between the parent and child occur, and children take over home management, finances, and other tasks for parents. It can cause disagreements and turmoil. Also, lack of support from the rest of the family or the adult child's spouse can cause issues when splitting time between their own nuclear family and their parents. Spousal roles changes are also common in that spouses may take an opposite role that they may not be used to, along with the roles that they already possess, such as homemaking responsibilities and changes in financial responsibilities. Second, conflicting demands typically arise when caregivers are juggling not only caregiving but work, volunteering, and if they are adult children, their own families and responsibilities. This can cause overload, resulting in decreased sleep, increased risk for poor health outcomes, and mental health issues. Caregiver burnout can also be caused by unrealistic expectations. There can also be a discrepancy between what individuals think is best for the care recipient and their abilities and their own wishes. It is very important to have candid conversations with your loved ones regarding their own wants and needs as well as your own. Lack of control can also be a reason for burnout, which can occur when financial troubles strike, lack of resources and time arise, and when the inability to manage loved ones' care the way that caregivers feel fit occurs. Unreasonable demands can be placed on caregivers, and caregivers can also place unreasonable demands on themselves. Some caregivers experience role engulfment when caregiving becomes their main occupation and they do not have time for other valued occupations such as work or leisure. Caregivers can also neglect their own health, which can result in poor physical and mental health of the caregiver, or eventually inability to care for their loved one. Also, family members not directly involved in the care of their loved one can place unreasonable demands on the caregiver, causing family conflict. Lack of autonomy has also been cited as a reason for caregiver burnout, as caregivers have less time to do leisure activities that they enjoy and have less time for themselves due to the demands of caregiving. Lastly, lack of mastery or confidence with caregiving tasks can also cause caregiver burnout. It is pertinent that caregivers are given the right tools and education by healthcare professionals in order to help caregivers feel safe, assured, and valued in their role as a caregiver. Often, caregivers do not recognize they are suffering from caregiver burnout. However, by recognizing these signs, caregiver burnout can be identified and then addressed. Among the signs and symptoms are lack of energy, insomnia, severe weight loss or gain, losing interest in valued activities, and neglecting emotional and physical needs. If not addressed, these symptoms of caregiver burnout can result in negative physiological and psychological outcomes for caregivers. Other symptoms or signs of caregiver burnout are anxiety, feelings of hopelessness, feeling irritable, a weakened immune system, and withdrawing from the world. As stated before, if these signs and symptoms of caregiver burnout are not identified and addressed, caregivers can experience negative psychological and physiological outcomes. These outcomes can result in an inability to care for loved ones and force caregivers to institutionalize their loved ones. Thus, it is vital that caregivers are recognizing these symptoms and combating them appropriately. Caregiver burnout can be prevented with the right strategies, coping mechanisms, and supports. As a caregiver, never be afraid to ask for help from family, friends, and neighbors. You do not have to take on the role of caregiver on your own. Take breaks like going for a walk, watching an episode of TV, or reading a chapter in your favorite book. Take care of yourself by making sure you are getting enough sleep, taking your prescribed medication, and attending your own doctor's appointments. Another way to prevent caregiver burnout is to practice mindfulness. Some great ways to practice mindfulness is to meditate, pray, or stretch for 10 to 15 minutes a day. Another way to combat caregiver burnout is to attend support groups. Studies have shown that support groups can help improve quality of life for caregivers and decrease caregiver burnout. Conversing and connecting with individuals who are experiencing similar situations can be very beneficial for caregivers. There are both in-person, online, and telephone support groups available for caregivers. Considering respite care options is also a viable option to prevent caregiver burnout. While it can be difficult during the age of COVID-19, respite care options can still be obtained to give caregivers a much-needed rest break. Respite care options include companion care, personal care assistance, adult daycare, or caregiver co-ops. These ways to prevent caregiver burnout are not an exhaustive list, and there are other coping strategies that can combat caregiver burnout that can be obtained through looking at online resources. Here are some resources and their online links to help caregivers prevent or combat burnout. The Arch National Respite Network and Resource Center, Caring.com, and Well Spouse Association provides caregivers with options for respite care by simply putting in your state and zip code. There are plenty of stroke support group options in the KC area and beyond that can be found on Stroke Support Group Finder from the American Stroke Association, along with the online options and Facebook groups for virtual supports during the age of COVID-19. Here are some resources and videos from SageMinder and AARP for quick, easy, and helpful guided meditation, breathing, relaxation, and imagery exercises. Here are the resources I used to create the presentation. Thank you all for listening to this presentation. I hope you found it helpful and informative. Have a wonderful day.